Hello everyone. Welcome to my channel. Visiting a doctor's clinic. Hello and welcome everyone. Have you visited your doctor recently? Let me share to you my latest experience. We waited for almost 3 months and finally, the appointment day has arrived for my husband and myself. It was a foggy afternoon, and we are driving a total of 20 miles to visit our new eye doctor https://amazon.to/41efe. Upon arrival to the clinic's parking area, there's a direction sign pinpointing to the clinic's entrance. I was about to open the clinic's door when I noticed a sign stating that we need to call their clinic before entry, so we stood outside and called the clinic. We were cleared to get in. We registered and completed necessary paperwork and sat down in the waiting room. There were several patients waiting to be called. In front of where we are sitting, there were 4 elderly women sitting that seems ages from 75 to 80 years old. I noticed that they were so quiet and so focused. Everyone was busy on their cell phones. I was intrigued. I remember on my younger years, I learned how to use email when I was on my 30s. In fact, until now I am not that computer savvy. After 45 minutes of waiting, I was called to the examination room. Being a nurse, I got a habit of observing the healthcare providers attending to my needs. In the room, I was greeted by the doctor's assistant. She did some visual and non-invasive reading tests. She was nice, but I noticed that she did not wash her hands or use sanitizing alcohol prior to attending to me. Few minutes passed, I was told to wait again in the waiting room. Another 30 minutes, and I was called again. I was instructed to go to another examination room. The room was clean and with different eye machines. The leather chairs seemed a bit worn out. Soon the eye doctor came in. He introduced himself and started the eye testing, and some eye drops were instilled in my eyes to dilate the pupil. The doctor was polite and seems knowledgeable. After his examination, I was told to wait outside in the waiting room. Almost 50 minutes passed, I was called for the 3rd time. Another visual test done. I was happy with what I was hearing. The doctor stated, all clear and no eye problems. I was so relieved. I need to visit my eye doctor every 1 year due to my diabetes. My husband got good and healthy eyes too. Suggestion and recommendation. It is recommended and vital for everyone to do your annual physical and health checks with your doctor. Schedule your eye checkup and use preventative eyeglasses https://amazon.to/41efe. Prevention is better than cure. We can prevent and reduce health problems significantly by visiting our primary doctors. Do your yearly blood works and examination. Yes, the doctor's visit took almost 3 hours. But we are happy to know that our eyes are healthy. A new eye appointment was made for us. This time the appointment was scheduled 12 months ahead. Nowadays, scheduling a doctor visit is a challenge. Patients encounter long waiting lists. Put in mind that virtual consultation and telehealth are available, an option for elderly patients who can't drive. For faster delivery and medications need, click https://amazon.to/3vcloak. Please follow my blogs and find more articles related to telehealth and virtual doctor's visit. I hope you enjoyed this blog. I highly appreciate your time and comments. Kindly leave a short comment. Every comment will help me to improve the content of my blogs and articles. Thank you and see you in my next blog. Understanding telehealth and in-person visits. Hello everyone. Have you seen your doctor today for a wellness check? Did you encounter appointment delay in scheduling? After the pandemic, scheduling a doctor's visit became a challenge for many people. It is about 2 to 3 months waiting before you can see a primary doctor. It is a longer wait for specialty consults and procedure. Nowadays, telehealth or virtual doctor's visit are becoming popular due to convenience, easy access, and shorter waiting time. Telehealth is a new popular way to speak and be examined by your doctor via social media platforms such as Zoom, WebEx, and more. Physicians and patients communicate using a camera on their desktop, laptop, iPad, and cell phones. Virtual doctor visit is like checking your heart rhythm away from the hospital or clinics. https://amazon.to/41cccw. The traditional face-to-face doctor's visit experience are now reduced. Spread of communicable diseases and infection are lower due to less public traffic in many doctors' clinic. There are many circumstances influencing the choice between telehealth and in-person visits. Analyzing the benefits of face-to-face doctor visits. Personal connection, the value of bonding with your physician. Immediate access to medications and prescriptions. Comprehensive assessments, the advantages of one-on-one evaluations. The importance of on-the-spot blood works and diagnostics. Weighing the advantages of telehealth services. Minimizing infection risks, reducing the chance of contamination. Convenience in scheduling, adapting to patients' timing. Eliminating travel, how telehealth is reshaping access to care. The efficiency of preparations for a virtual visit. There are trade-offs of telehealth versus traditional in-person visits. Remember the conundrum of wait times and convenience in face-to-face visits. Patient scheduling doctor's appointment, after a month appointment needs to be rescheduled, and so on. Also, risks associated with in-person appointments such as exposure to multiple communicable diseases. Patients who have low immune system are not safe from airborne infection and contaminated surfaces in clinics or hospitals. However, there are few challenges in telehealth too, such as delays in blood work and hands-on assessment. In comparative analysis between telehealth and in-person doctors visit, we need to balance the risks, costs, and benefits. We need to ask ourselves, can I wait several months? Is my body strong enough to fight airborne infection? Making a decision to choose a method in visiting your doctor really depends on how you feel. We need to weigh the pros and cons. Now, if it's an emergency, please visit the emergency room for immediate intervention and treatments. Please bear in mind that being seen in the emergency room gives you an opportunity to see an in-person doctor, and all diagnostic procedures can be done right there. But, the chances for you to wait long hours is inevitable unless you are critically ill. The emergency room prioritize and see clients according to presenting symptoms and illness of each patient. They attend first to medical emergencies such as cardiac arrest, trauma, stroke, and more serious cases. My personal recommendation is to book in a telehealth doctor's visit if the in-person visit will take more than a month. If you are in pain and needs to be examined as soon as possible, that may require emergent imaging and scans, go to the emergency room department of the hospital nearest to you. Don't delay your annual health checks. Again, it is easier and better to prevent than cure any health concerns. Do not ignore your health care. Have a peace of mind and enjoy living a healthy life. I hope you enjoyed this blog. I highly appreciate your time and comments. Kindly leave a short comment. Every comment will help me to improve the content of my blogs and articles. Thank you.